Have you ever made a decision that felt right in the moment, but then a few weeks later you caught yourself thinking, I wish I had slowed down and looked at this a little closer? Comment your name and state below. I'd love to see who's watching and benefiting from these videos. That feeling is something almost every Medicare beneficiary experiences at least once, especially after annual enrollment ends and real life starts kicking in. The commercials are over, the mailers stop coming, and suddenly you're holding a summary of benefits in your hands, realizing this plan isn't quite what you thought it was going to be. I talk to people every single January who tell me the same story. In October or November, they felt rushed. They were told this plan was all-in-one, that it covered everything, that dental was included, vision was included, and it would save them money. On paper, it looked great. But once January rolls around and they actually start using the plan, that's when the questions start. The dentist says, we're not in that network. The oncologist says, you'll owe 20% of this treatment. The pharmacy says, your medication isn't on the formulary, so that'll be full price. And that's when the panic sets in. This is especially true heading into 2026, because Medicare Advantage plans have changed in ways a lot of people don't fully understand yet. Dental coverage is a perfect example. For years, dental benefits were used as a big selling point. Free dental, comprehensive dental, thousands in dental benefits. But what we're seeing now, and what's becoming even more common for 2026, is that dental coverage has been scaled back. In many plans, it's limited to preventive services like cleanings and exams, sometimes with a very small annual cap, and often tied to a narrow HMO-style dental network. That means if your dentist isn't in that network, the benefit may as well not exist. I had a client last year who was thrilled about their new plan because it advertised dental. They needed a crown. When January came and they went to schedule it, they found out the plan only covered cleanings, not major services, and only with a short list of dentists, none of whom were within 30 miles. That's not what most people think of when they hear dental coverage, but it's the reality for many Medicare Advantage plans going into 2026. Now, here's the part most people don't realize, and this is where a lot of hope comes in. Just because annual enrollment ends on December 7th doesn't mean you're completely stuck. If you're on a Medicare Advantage plan, you have another opportunity to make a change during the Medicare Advantage open enrollment period, which runs from January 1st through March 31st. This is often called a do-over period, and while it's not completely open-ended, it does give you meaningful options. During this time, if you already have a Medicare Advantage plan, you can switch to a different Medicare Advantage plan. Maybe you realize another plan has a better network, better drug coverage, or slightly better dental benefits for your situation. You can also choose to leave Medicare Advantage altogether and go back to original Medicare. That's a big decision, but for some people, it's the right one, especially if provider access and flexibility matter most. Original Medicare allows you to see almost any doctor or hospital in the country that accepts Medicare, which is most of them. There are no networks to worry about, no referrals required, and no surprises about whether a specialist is in or out. The trade-off, though, is cost sharing. Original Medicare leaves you responsible for 20% of most Part B services, and there is no maximum out-of-pocket limit. That's why many people pair Original Medicare with a Medicare Supplement, also called Medigap, to cover those gaps. Here's where things can get tricky, and where professional guidance really matters. If you're new to Medicare or you live in a state with strong guaranteed issue rules, switching to a Medigap plan may be simple. But in many states, if you've been on Medicare for a while and you're leaving a Medicare Advantage plan, you may have to go through medical underwriting to get a Medigap plan. That means answering health questions. Depending on your health history, some plans may accept you and others may not. I've seen people make the mistake of dropping their Medicare Advantage plan first, assuming they can just pick up a supplement afterward. That's risky. The smarter approach is to apply for the Medigap plan first, get approved if underwriting is required, and only then disenroll from Medicare Advantage. That way, you're never left without coverage. Another big issue that keeps coming up for 2026 is prescription drug coverage. Formularies are getting tighter. Some medications that used to be covered are now on higher tiers or removed altogether. And while there have been important changes to cap out-of-pocket drug costs under certain laws, those protections only apply if the drug is actually on the plan's formulary. If it's not listed, those caps don't help you. That's why reviewing your drug coverage every year is so critical. I've talked to people who stayed on a plan because the premium was low, only to discover in January that one medication alone would cost them thousands out of pocket. That's not a small oversight. That's a life-altering expense. And it's exactly the kind of thing that can often be avoided with a careful review and the help of someone who does this every day. This is also the time of year when many people discover their doctor or hospital is no longer in their plan's network. Provider contracts don't always follow the calendar year, which means changes can happen even after you enroll. Suddenly, the specialist you've been seeing for years is out of network, and your plan no longer covers those visits the way you expected. For someone dealing with chronic conditions or serious diagnoses, that can be devastating. Cancer coverage is another area where reality often hits hard. Many Medicare Advantage plans require you to pay 20% of chemotherapy, radiation, and other treatments up to the plan's maximum out-of-pocket limit. And because many of these plans are HMOs, your choice of treatment centers may be limited. Some of the most well-known cancer centers in the country are often out-of-network for Medicare Advantage plans. That's something people don't think about until they're facing a diagnosis, and by then, options can feel limited. This is why January through March is such an important window. It's a chance to reassess, to ask better questions, and to align your coverage with your real needs, not just what sounded good in a commercial. And it's also why working with an independent Medicare agent can be so valuable. An independent agent isn't tied to just one company. They can compare multiple plans, explain trade-offs, and help you understand what's changing for 2026 and beyond. One thing I want to be very clear about is cost. Getting help from an independent Medicare agent does not cost you anything extra. The plan premiums are the same whether you enroll on your own or with assistance. What you gain is experience. Someone who has seen these trends play out across different states, different carriers, and different benefit designs can often spot red flags before you ever feel the consequences. I've seen waves of change move across the country. What happens in one state this year often shows up in another state the next. Dental benefits shrink. Networks tighten. Drug formularies change. Agents who work nationally see these patterns early, and that perspective can make a huge difference for someone making a decision that affects their health and finances. Timing matters too. If you make a change in January, your new coverage typically starts February 1st. If you make a change in February, it starts March 1st. If you wait until March, coverage begins April 1st. Those effective dates are important, especially if you have upcoming appointments, procedures, or prescription refills. I know this can feel overwhelming. Medicare isn't simple, and it's not designed to be intuitive. But you don't have to navigate it alone. Whether you're realizing your dental benefits aren't what you expected for 2026, your medications aren't covered the way they should be, or your doctors are no longer in network, there is still time to make informed choices. The key is not waiting and hoping things work themselves out. Review your summary of benefits. Look closely at dental, drugs, networks, and out-of-pocket costs. Ask questions. Get a second opinion. This is your health, your money, and your peace of mind. If you're sitting there thinking, I wish I could redo this decision, that's exactly what this period is for. January through March is your opportunity to course correct. And when the help is free and the stakes are this high, there's no downside to getting guidance. Again, comment your name and state below. I love seeing where people are watching from, and more importantly, I want you to know you're not alone in this. These decisions are complex, but with the right information and support, you can move forward with confidence, even in a changing Medicare landscape heading into 2026.